Greetings again. This is Unit 13. We're going to do a two-segment lecture series here where we're going to discuss common diseases of sheep and goats. So let's get to segment 1 here and hit in some of the things. Some of them, again, will be repeat diseases that we've seen already, but we'll talk about the impact on sheep and goats. First, of course, is foot and mouth disease. We've led off nearly every section talking about foot and mouth. No different in terms of the risk, the outcomes, the virus that causes this, the necessity to really be proactive in reporting it. Should you encounter foot and mouth disease in sheep and goats, it's going to be highly fatal and extremely problematic. And again, the transmission during the febrile stage will be found in saliva, blood, urine, milk, muscle, in terms of shed that way. And so you have to be really cognizant of what your risk factor is here. Contaminates a lot of things on your farm, so you have to be really proactive and then sanitizing those things. Symptoms, very high fevers within the first 12 to 14 hours, and then blisters in the mucous membranes, as we've talked about before. There's really no vaccination or treatment protocol here. These animals are going to be eliminated from your operation, and your operation will be in quarantine for some period of time. Next is bloat, and this one again is problematic in both sheep and goats. We talked about this one back in cattle as well. Non-contagious disease, as we talk about accumulation of gas in the rumen, could be chronic, could be acute. So it could be just an acute one-time event where they've got just a gastrointestinal upset triggered by maybe too lush of a pasture or too much grain or something like that. Or you can have sheep or goats that get this chronically. They just, for whatever reason, they're susceptible to it, and so they'll eat something that upsets their tummy, they bloat, it goes away, or you treat it, and then a few days later or a few weeks later they do the same thing. So again, caused primarily by feed, and excess gas production in the rumen, and getting those bubbles or saponins that develop in the rumen, which gets that frothy bloat thing going in the rumen, which is difficult to overcome. Again, symptoms, distension or gas buildup on the left side of the animal, particularly. They'll be off feed and move kind of uneasily and breathe kind of real laboring in fashion, and eventually have trouble standing if it gets really acute. Again, prevent this by good quality feed ingredients, good quality pasture. Don't turn out really hungry goats and sheep on really lush, especially legume pasture like very lush alfalfa or very lush clover. That could set them off here. And always keep water available. Treatment protocols are listed here in the bottom right hand of the screen. And first things first is keep them moving. That sometimes will help break those gas bubbles down, get them to belch and pass some of that gas. If it really gets ambulatory, then you may need to pass a garden hose or something down to help relieve the gas. Use a trocar and cannula if it gets really terrible, and you're probably going to support with penicillin. Moreover, if you need assistance, call your veterinarian. They'll be willing to help you out very quickly. Traumatic reticulitis or hardware disease, again, problematic when we talk about sheep and goats. Very simply because they will graze very close to the ground, so they have a really higher risk than cattle of getting hardware, really, especially when you talk about goats, because they'll eat pretty much anything. Again, ingesting very sharp objects such as nails or screws, wire in particular, and symptoms are listed on the bottom left-hand side of the screen here, and you get really a lot of painful stances. An arched back would be a great example. Low-grade fever, and we say low-grade because they will kind of just spike small fevers for short periods of time, and they'll be kind of low-grade and persistent, not ever, most of the time, not ever very high. Elevated respiration rate, because there's usually a little bit of infection going on there, so they will look like they're huffing and puffing a little bit, but don't have really any other symptoms of a respiratory type problem. Preventative features here, go with a bar magnet. That's really easy to do. They're really small. You can administer them orally, and they will hang out there in that reticulum and help prevent these things. Just good maintenance of any of your feeding or fencing materials on the farm. Treatment, antibiotics. Surgery is going to be a tough one here because of the cost associated with it when we talk about sheep and goats. So it better be worth it. Good cost analysis would be important here. But work to prevent peritonitis here because that's associated with this one often. The next disease that we'll hit on is impaction. Excuse me here. This is where we've ingested the animal, the sheep or goat has ingested a lot of really high carbohydrate feed and produce a lot of excess lactic acid. That really kind of slows down sometimes the gut motility. Again, oftentimes associated with high grain consumption. So you get a lot of rapid fermentation going on, and symptoms or signs here, we got the two sections here talking about that, where they have dehydration or blindness, listlessness, abdominal pain, grunting especially, diarrhea, or grinding their teeth. You'll see a lot of different things that could be associated with impaction. And you're going to treat it with maybe some mineral oil in order to help stimulate some muscular movement in the small intestine, help get that stuff lubricated and moving along. If you want to help prevent it, feed a little bit of consistent sodium bicarbonate, maybe just a little bit of free choice somewhere in the feeder. They'll lick on it whenever they have stomach upsets, and that will help them along. If you have one that has a problem acutely with impaction, decrease the grain and increase the hay feeding content, and then add a little bit of penicillin to the diet, or add a little bit of penicillin injectable, excuse me. Keratinitis, I mentioned this one just a few slides ago. Again, this one is often associated with some kind of injury or other infection like harbor disease, where you would have tenderness, pain, or injury somewhere inside the body that causes some kind of perforation somewhere along the tract, and then an internal infection is set off. Coccidiosis, again, makes its appearance. We talked about this one in calves, but it's also common in sheep and goats. And again, still that the lower gastrointestinal protozoa parasite that's going to cause this coccidiosis outbreak. Again, oftentimes associated with stress or overcrowding. That parasite lives there normally. And in low population conditions, it won't cause any trouble in young lambs or young goats. But if it is associated with some kind of stressor, that protozoa can proliferate and therefore cause the outbreaks that we see here with some of the blood-stained diarrhea associated with pneumonia oftentimes, and can be pretty severe for a few weeks at a time, or a week or 10 days at a time. So prevent it with, again, good, clean environment, clean feed and water. Clean those facilities out the best you can, expose them to the sun if possible, and then feed a little bit of an inophore, a Bovatec or a Decox. The active ingredients are listed here under the treatment protocol with salicid or decoquinate. That's Bovatec and Decox. Amprolium is what you can add to the water, or maybe even feed. You can feed that to help treat cocci. Pyometra, again, we've talked about this one in multiple species, and it makes its appearance again here with sheep and goats. At any time that you have an associated infection of the uterus, they're at risk for pyometra, where you would have pus accumulation potentially in the uterine tract. Therefore, the animal would probably be anestrous. And so you'd probably go with some kind of systemic antibiotics in order to help treat this one. Pasteurella is next, one of our first respiratory problems to make its appearance here with sheep and goats. And again, anytime that you're moving sheep and goats, you would have a risk for this pasteurellosis to develop, which is shipping fever, and that's caused by a whole complex of Pasteurella species. So you'll see fever and coughing and snotty noses and runny eyes and all kinds of things. And the best way to help prevent that is good vaccination protocol, and then treat it with sound antibiotic therapy. Tetanus, again, another one that we've talked about a number of times, and again, one that, especially when you talk about goats, because of their curiosity, they'll get into all kinds of things. Could have issue with tetanus potentially. I won't rehash much of this because we've already talked about tetanus in a pretty good detail in the other species. Same symptoms, same problems, same treatments. So let's pause here as we're about 10 minutes in and conclude episode 1. We will come back with the second segment and wrap up our conversation with sheep and goats. Thanks for tuning in.